Dear friends, we continue our BG Dental cases, reviews of clinical cases. This is episode number 13. I don't know how it comes in your countries, but number 13 in Ukraine, for example, considered to be something like a mysterious number. And we can say that this number nowadays is devoted to the situation that we have in the whole world with this coronavirus. So basically this episode number 13 is similar to the global mysterious or maybe sometimes dramatic situation. But I would like to assure you that everything will be all right, everything will be okay with all populations in the world. We have to keep quarantine, just not to overload medical system, okay? And it will pass very soon, and we can go back to our present and normal life flow. We continue our initiative to support colleagues all over the world during quarantine, and these dental cases I think will be very useful nowadays because many people, they have now free time. And also I would like to mention that we have opened actually free access to our online masterclass for free. If you want to participate in this online masterclass, you can follow the link to description to that video and participate in this intensive online masterclass until 5th of April. Okay? So, today we will discuss with you a very interesting case that is devoted to trauma. We will discuss the tactics and strategies when you have cases with the young patients, or maybe not with young patients, but actually when you have to solve the problem when people have trauma and you have actually fragment of the tooth that can be bonded to the initial substrate, tooth abutment. Okay, so here is the initial situation. This is young boy. He is only 7 years old. He was a hockey player. Actually, he is a hockey player still, and he got this trauma during the training. And we got a phone call from his mom. She was very excited. She was very upset. And if you have something like this, the first aid to the patients in that situation will be to guide parents of these kids or to guide the kids themselves to find the fragment of the tooth that was broken. This is very important because we can really bond these fragments to the teeth abutment and everything will be really all right. Fortunately, they were able to find the fragment, okay? And then another guidelines, if we have this fragment, we have to teach and to instruct parents and kids where to hold these fragments until they will be delivered to dental office. So the option number one is to hold this fragment into just normal milk, okay? If there is no possibility to find the milk, they can hold and keep the fragment in normal saliva. So basically they can keep them in saliva, and then you can just bond these fragments during the process of restorative treatment. In case if patients cannot be presented in dental office within really a quick time, let's say, no worries, they can still keep these fragments in the milk or in saliva, and then you can bond these fragments later on. But we have to be really fast in such cases because kids, they have really wide dentinal tubules, and there is a big risk that dentinal tubules and pulp then later on can be contaminated with the bacteria. So actually we can get the pulpitis or periodontitis later on. So that kind of clinical situations, they have to be resolved in very short period of time. Okay, so this patient was delivered to our dental office in a very short period of time, fortunately. But what actually we have got out of the trauma, you will see, we got also a very tough situation because the pulp was exposed. Okay, And I will show you my strategy. I will show you my protocol to solve the problem with that particular case, but I would like to ask you one question. What is your tactics if you have pulp exposed in such a case? Please write down in comments to that video your thoughts and your approach in similar cases when the pulp is exposed. For example, you may write down like I will put calcium hydroxide, or I will put MTA, or I will put biodentine, or I will put glass ionomer cement, or I will put nothing, just direct bonding protocol, and so on and so on. I would like to get your opinions, because our online platform, this YouTube channel, and this the BG Dental Cases series now become something like a global educational platform where everybody can contribute. So basically, when you write down your comments, you are participating in a professional discussion. By the way, if it is possible, if you have time, write down your answer and just briefly why, okay? Why you would like to put calcium hydroxide. Maybe you refer to some articles. So basically, having your answer and reference to the article, other people can get this information for education. So you are contributing in the global information exchange. So that's really amazing nowadays because of the internet and possibilities to communicate worldwide with no borders and no limits. Okay, and also, by the way, I didn't mention that at the beginning of the video, but I would like to do it right now, because we have now about 25,000 followers on our YouTube channel, and I would like to ask you to put likes to the video if you like it. Put like, please. Don't be lazy, because when you put likes, YouTube start to spread the video more and more through the followers and the audience, like ourselves. I mean, through the dental audience, and many people, many dentists can see that content, can educate, can get this information for free, and so basically they can become better and better because of you and because of us. And this is good to share that experience globally. Okay, so what I did in this case, I didn't put anything. I just go straight to bonding protocol all over this exposed pulp, dentin, and enamel. I followed protocol that was offered by John Kanka. You can Google John Kanka, his articles. And the protocol was pretty simple. It depends what type of adhesive system you are using in such a case. I used total etch system, so basically what I did, I just etched enamel. We can have this upset pulp here. So I etched enamel for 30 seconds and also etched enamel for, dentin for 5 seconds, rinse, dry, and then I applied the adhesive system. In this case, I used Optibond FL. I used fourth generation of adhesive system with a separate primer and separate adhesive. Okay, and then I just bond my fragment with highly filled flowable composite. Basically, we have to provide adhesive protocol also for this fragment the same way as we do for the tooth abutment. So for that fragment, we etch enamel same time, we add dentin for same time, or if you use a self-etch adhesive system, you just etch enamel, you are not etching dentin, okay? So that is pretty simple. But before doing anything with the adhesive protocol, we do isolation, which is really important in such a cases, because isolation with a rubberdam provides really nice and clean aseptic environment. Then we have to try in fragment to be able to understand and to be sure that fit of the fragment is correct, and then we go for adhesive protocol. So okay, again, isolation, fit check, and then we go for adhesive protocol. Etching, rinsing, drying, then bonding, and then I used highly flowable composite to bond these fragments. So basically the protocol is pretty similar as we use for cementation of porcelain veneers. By the way, if you want to get more information or get knowledge about porcelain veneers, we are preparing a really high-end and advanced online masterclass that is dedicated to porcelain veneers and discolorations that will be over-shoulder format with presence effect. You can also use link to that online masterclass to the description of this video. Okay, register. And again, during the process or during this quarantine time, we decided to support you with another online masterclass that we will give you for free. So basically, when you will sign up for veneers in discoloration online masterclass, you will get one more masterclass for free. You get two instead of one during this quarantine time. So hurry up. You'll get a really good content with more than 5 hours useful, practical, didactic dental information. Okay, so this is straight after cementation. The polishing protocol is the same as we use for direct composite restoration, using discs, rubbers, paste for composite materials, and we got follow-up for years. Okay, we have this follow-up for years. The picture was taken during the summer vacation time. We are friends with family of this guy, with parents. We are friends, and I was not able to check up this patient after 4 years in my dental office because they are from different city. But I was able to take a picture with a phone during the vacation. You can see some slight discoloration, and at the margin between tooth and the fragment is here. And it's pretty simple to fix just by polishing. You will repolish the junction, and that's it. I also asked the mom of this patient to make an X-ray in dental office in their city, and they send me by email. You can see that everything is super fine. And direct adhesion to the pulp exposure actually works, as you can see in this case. And I was not really stressed to follow this protocol because the pulp is intact. The regenerative ability of the pulp is really high, and everything will be alright if you are using isolation and proper bonding protocol in such a cases. Summary. Okay, first you have to find fragment, to hold the fragment in the liquid like a milk or saliva, then try in isolation, bonding protocol. It depends if you follow direct pulp cupping with a calcium hydroxide, MTA or whatever, or you go straight. Okay, what else? I would like to say that you have to check up these cases like in such approach. So you bond, and then you go for, after 1 week, you do a pulp test, like just a cold test. Then you do same in 1 month, cold test and X-ray. Then half a year, cold test and X-ray. And then after 1 year, cold test and X-ray. So you will have to check up everything, especially vitality of these teeth. And as you can see here, everything was fine. I asked the dentist in their city to provide also the vitality test. The tooth is vital. We are very happy. We can prove that everything works. And the good thing is, due to adhesive dentistry, nowadays we can solve such problems for our young patients. Okay? That's it. I would like to thank you first of all to being with us. And I would like to ask you not to forget to sign up to our YouTube channel, to put likes, to put your comments, and to follow us, and to keep in touch, because we will continue with these BG Dental cases, I think probably every week. So thank you very much one more time, and keep in touch. Bye-bye.